Moving on to corticotropin releasing hormone. It is a peptide hormone secreted by paraventricular nucleus of the hypothalamus. It stimulates the secretion of adrenocorticotropic hormone from the corticotropes of the anterior pituitary. ACTH is otherwise known as corticotropin. This corticotropin releasing hormone also stimulates the expression of pro-opiomelanocortin gene in the corticotropes. This gene expression is very essential for the formation of adrenocorticotropic hormone. Then let's see about growth hormone releasing hormone, which is a peptide hormone. It is secreted by the arcuate nucleus of the hypothalamus. So you can understand from the name itself that it is a growth hormone releasing hormone, meaning it stimulates the secretion of growth hormone from the somatotropes of the anterior pituitary gland. Hypothalamus secretes prolactin releasing factor, which is also peptide in chemical nature, but the source is not yet known, and it stimulates the prolactin synthesis and secretion from the lactotropes of the anterior pituitary gland. So we also have this growth hormone inhibiting hormone from the hypothalamus. So this is also called somatostatin. It is also peptide in nature and it is secreted from the anterior periventricular nucleus. Again, from the name you can understand that it inhibits the secretion of growth hormone. So not only that, it also inhibits the secretion of prolactin and thyroid stimulating hormone. So we have now the prolactin inhibiting hormone, which is also a peptide hormone, and it's secreted from the arcuate nucleus of the hypothalamus. So it inhibits the secretion of prolactin, thyroid stimulating hormone as well as growth hormone. Then let's see about antidiuretic hormone and oxytocin. So this antidiuretic hormone is primarily formed from the supraoptic nuclei of the hypothalamus, and ADH plays a main role in the regulation of serum osmolarity. Then oxytocin is primarily formed from the paraventricular nuclei. It plays a main role in ejection of milk from the breast, and oxytocin also plays a main role in contraction of the uterus during delivery. Please note that each of the nuclei can synthesize about 1/6 of the second hormone. That is, antidiuretic hormone is also secreted from the paraventricular nuclei, and oxytocin is also secreted from the supraoptic nuclei, but in a very less quantities. So here you can see the various hormones secreted by the anterior pituitary and posterior pituitary glands. So by knowing this, now you know how hypothalamus is having a regulatory function on the secretion. So the hormones secreted by hypothalamus have to be regulated, and this is mainly by negative feedback mechanism. So if it is not regulated properly, the dysfunction of the hypothalamus, it can lead to abnormalities of the hypothalamo-endocrine axis. And it is because of this, irregularities will occur in anterior and posterior pituitary secretions, and many target organ dysfunctions will occur. So that is briefly about endocrine functions of hypothalamus, the various hormones secreted by it and their functions. Thank you and have a nice day.